We want to hear your thoughts on reports out of Norway of a recent string of deaths among the elderly there after they were vaccinated against COVID-19. Now, Norwegian health authorities are saying there is no evidence of a direct link between the recent deaths among elderly people inoculated against COVID-19 and the vaccine they received. 33 people in the country, 75 years old and above, have died following immunization. The Norwegian Medicines Agency noted all of them were already seriously ill and said, quote, "It's difficult to prove that it's the vaccine which is the direct cause." But the agency also said that it's possible that the side effects of immunization can, in some cases, tip the patients into a more serious cause of the underlying disease. Until last Friday, Norway had only used the Pfizer-BioNTech vaccine. The companies are now working with Norway to look into the deaths. Now let's bring in our experts once again. Prof. Fisher, should the elderly in Singapore be concerned over getting their vaccine? Now, in light of what we're seeing in Norway, Germany as well.
So firstly, we need to look at what's happened in Europe and assess the validity. I read that there are 400 nursing home deaths every week in Norway. So that's not to trivialize those, but you're injecting a part of the community with a high death rate anyway. So I think this does need to be kept in perspective. I do accept what they're saying, that it's, I think they mentioned fever, nausea, diarrhea as side effects. And if for instance, an elderly person is very frail and perhaps has some renal failure or cardiac failure, or and then gets further dehydrated through diarrhea, then that could have consequences if someone is very frail. And that's the message Norway's giving out, and they're investigating it. I think the important message here is, though, that even though the phase 3 trials are complete and we're rolling out vaccinations now, and now there's been tens of millions of people around the world had it, this post-marketing surveillance needs to continue. We need to, I think what we've heard in Norway tells us that we're remaining vigilant to news that might inform how we roll this out going forward. So I think, in summary, I would keep what's happened in Europe in perspective, and just remind us that the system's working. Indeed, if everyone's vaccinated, then that means everyone who dies will have been vaccinated. So if you look at it in that extreme setting, you can see why you're going to get adverse events happening once you've got, or apparently happening, once you've got millions of people vaccinated.
Right. Prof. Cook, on to you. Why is it important for older people to still get vaccinated despite the low numbers here?
So the numbers are low in the community just now, but we can't take that for granted. It's not necessarily going to be the case that we can keep the level of infections at this low level for indefinitely. And so I think as a result of that, it's important to get the vaccine when it becomes available to you. In the long run, we may be vaccinating a million people a month or something like that. But if we have an outbreak all of a sudden, then you're going to end up with a lot of people who are trying to get vaccinated, but we won't be able to manage that. We can only manage 1 million a month, right? That means then that it's important that when your slot comes, it's not worth delaying just over this potential risk. A point that Dale quite often makes is that there's a potential risk with vaccines, but there's a very real known risk with getting COVID, and that far outweighs, especially for the older age groups, any potential risk of the vaccine.
Right, Prof. Fisher. In terms of criteria and health conditions, which older people should not take the vaccine for now?
So as a principle, I would urge all elderly people to get vaccinated. I would urge everybody to get vaccinated, but it's especially the elderly, whatever age you want to call that. Certainly maybe 70 plus, 75 plus especially. This is the group most likely to receive benefit. These have a higher death rate. We know this. and I wouldn't, perhaps on a case-by-case basis, I might give some exemptions. So if you've just had a flu vaccine, for instance, we suggest that you wait a month before having the next vaccine. That's just to separate them a little bit in terms of their immune response. I would think if you have a serious or life-threatening illness, and especially if you're getting treatment for that, and especially if you're heavily immune suppressed maybe in that treatment, then I could see some medical conditions where maybe it's not such a good idea to get the vaccine, largely because it won't be effective probably. But these are exceptional. I really would urge this to be a widespread uptake. And if you think you should be an exception, then have a talk to your doctor and discuss it on a sort of a case-by-case level.
Well, thank you so much, professors, for taking time off to speak with me today. I've been speaking with infectious diseases experts, Professor Dale Fisher from National University Hospital and Associate Professor Alex Cook from the Sosui Hawk School of Public Health at NUS.